Challenges of population explosion for India. The World Population Day is being observed on 11 July across the world every year. In this context, we need to take a look at our population problems. India is predicted to have overtaken China as the world's most populous nation by 2050. The growth rate of population is a function of migration, birth rate, and death rate in a country. The difference between the birth rate and the death rate measures the growth rate of population. According to estimates, Indian population has risen to 1.27 billion, out of which females constitute 614 million and males 655 million. The high population growth rates are due to high birth rate and fast declining death rates due to better sanitation and health facilities. However, the capacities to absorb increasing manpower are much weaker. Furthermore, the process of economic development tends to be more capital intensive under modern technological conditions and hence has less potential of employment generation in the short run. Since the total size of the population is already large, there is urgency for speedy achievement of demographic transition from high birth rate to low birth rate, resulting in a lower population growth. The effects of the rapid population growth in India are providing employment to growing population, problems of utilization of manpower, overstrained infrastructure, pressure on land and other renewable natural resources, increased cost of production, and lastly, inequitable distribution of income. Population and sex ratio. Sex ratio is an important parameter that reflects the status of women in society. Some of the worst gender ratios, including gross violation of women's rights, are found in South and East Asian countries such as India and China. In India, the sex ratio is declining, reaching up to 928:1000. But more important and serious thing is that with social, educational, economic development, it is declining. In 2011 census, it is seen that in all states except Bihar, Gujarat and Jammu Kashmir, the sex ratio is increased. It is also increased in the Union Territories except for Dadar and Haveli and Daman and Diu. Female mortality rate is observed to be very low in most of the parts of northern India, but comparatively, sex ratio is high in southern states of India. Reasons for neglect of the girl child and low levels of sex ratio and preference for sons, low status of women, social and financial security associated with sons, socio-cultural practices including dowry and violence against women. Small family norms may be a catalyst in the declining child sex ratio. Population and environment. As the 21st century begins, growing number of people and rising levels of consumption per capita are depleting the natural resources and degrading the environment. In India, the rapid increase of population combined with desperate poverty to deplete and pollute local resources bases on which the livelihood of present and future generation depends. Though the relationship is complex, population size and growth tend to expand and accelerate these human impacts on the environment. What is more concerning is the number of population rise will increase to such an extent in the future that it will cause overall scarcity for resources. India is having 18% of the world's population on 2.4% of its land area, which means that there is a great deal of pressure on all of its natural resources. National Population Policy of 2000. The National Population Policy was announced in February of 2000 with objectives aimed at meeting the needs for contraception, healthcare infrastructure, health personnel, and integrated service delivery. The midterm objectives are outlined as aimed at bringing the total fertility to replacement levels, that is 2 children per couple, by a vigorous implementation of intersectoral strategies. The long-term objective is stabilization of population for the year 2045. The policy has outlined 16 promotional and motivational measures to implement it vigorously. Among these, the more important are reward panchayats and Zilla Parishads for promoting small family norms, strict enforcement of Child Marriage Restraint Act and Prenatal Diagnostics Techniques Act. Health insurance covers of Rs 5,000 for couples below the poverty line with 2 living children who undergo sterilization and rewards for couples below poverty line who marry after legal age, have a first child after the mother reaches 21, accept small family norms and undergo sterilization after birth of 2 children. The National Commission on Population was constituted with the mandate to review, monitor, and give direction for implementation of the National Population Policy. Population and Food Security. The National Food Security Act of 2013, also called as the Right to Food Act, is an act of the Parliament of India which aims to provide subsidized food grains to approximately 2/3 of India's 1.2 billion people. Under the provisions of the bill, beneficiaries are to be able to purchase 5 kilograms per eligible person per month of cereals rice at 3 rupees per kg, wheat at rupees 2 per kg, and coarse grains such as millet at 1 rupee per kg. Pregnant women, lactating mothers, and certain categories of children are eligible for daily free meals. Every state will have to chalk out its own strategies for sustainable livelihood to move on the path of sustainable food production and sustainable livelihood security. This calls for sound policies and investments in natural resources such as land and water, flora and fauna, forests and biodiversity, the ecological foundations essential for sustainable food security, plus sustainable intensification of crops and animal production. Food security has three components. The first is food availability, which depends on food production and imports. The second is food access, which depends on purchasing power. The third is food absorption, is a function of safe drinking water, environmental hygiene, primary health care, and education. Strategies for delayed monsoon. Several measures are taken up to deal with the delayed monsoon. Some of them are a sound seed production and storage plan, seeds of alternate crops and varieties that can be sown in case of delayed monsoon, ensure availability of breeder seed of contingency crops or varieties which are not normally in the seed chain, village level seed banks, adoption of drought and flood tolerant crop varieties, and availability of inputs related to nutrient management. Population and healthcare. As per the industry reports, healthcare is poised to grow at an estimated annual rate of 19% to reach 1.4 lakh crore rupees by 2020, with India being recognized as a destination for world-class healthcare. During the last decade, the private sector grew to become the major provider of healthcare services. Its share of beds increased from 49% in 2002 to 63% in 2010. The Indian government has also introduced several reforms. The 11th and 12th five-year plans have led to successes, especially in the primary health area, maternal and child health, and infectious diseases. The National Rural Health Mission has achieved efficiency and health system reforms, while the Rashtriya Swasthya Bima Yojana, a national social health insurance scheme, has aimed to cover inpatient treatment, especially for the benefit of the poor. Apart from the All India Institutes of Medical Sciences in New Delhi, there are 6 AIMS institutes at Bhopal, Bhubaneswar, Jodhpur, Patna, Rishikesh and Raipur. The National Health Policy was formulated by the central government in 2002. The social obligation for the government to ensure the highest possible health status of its population, and as a part of this ensures that all people have access to quality healthcare, has been recognized by a number of key policy documents. They emphasized the following. A. The need to increase total public health expenditure from 2 to 3% of the GDP. B. The need to strengthen the role of the public sector in social protection against the rising costs of healthcare, and the need to provide a comprehensive package of services without reducing the prioritization given to women and children's health. The National Rural Health Mission was launched in April 2005 to provide accessible, affordable, and quality healthcare to the rural population, especially the vulnerable groups. The National Urban Health Mission, as a sub-mission of the National Health Mission, will meet the health needs of the urban population with the focus on the urban poor. Population and employment. As revealed by the 2011 census, the working age population will be far in excess of those who will no longer be able to work. Unemployment rates in India averaged 7.6%, reaching an all-time high of 9.4% in December 2010. According to the 66th NSS report, which the Government of India published in 2013, Kerala has the highest unemployment rates and ranks worst, while Rajasthan and Gujarat has the least unemployment rate among major states of India. These low figures could be due to non-registration of unemployed youths in the government records. Population and skilled labor. Beyond a doubt, our youth power is one of the most important assets for economic development. India's demographic dividend is a one-time window of opportunity that cannot be afforded to be missed. Almost 40% of India's workforce has received no formal training. Thus, a large section of India's population is virtually unemployable or can function as unskilled workers. The other side of this situation is that the Indian industry is facing a shortage of skilled labor despite the bulge in the workforce. This shortage is affecting the economy across both manufacturing and services sectors. For example, it has been estimated that the construction sector, on which almost 6% of the country's workforce depends for livelihood, is facing a 30% labor shortage. Filling the skill gap shortage in construction alone could add 1 lakh crore rupees to the Indian economy. In order to tackle the situation, steps like skilling of the new entrants to the workforce, upskilling of workers for higher or new skills, and recognizing informal, on-the-job training of existing workers are the need of the hour. Population and poverty alleviation. The government recognizes that high growth of incomes is by itself not enough to improve the quality of the life of the poor. Unless all the citizens of the country should have certain basic minimum services, a list of 7 services required are safe drinking water, primary health facilities, universal primary education, nutrition to school and preschool children, shelter for the poor, road connectivity for all villages and habitations, and lastly, the public distribution system with a focus on the poor. Since the 9th plan, there has been special emphasis on these 7 basic minimum services to achieve a minimum level of satisfaction in providing these in partnership with the state governments and the Panchayati Raj institutions. The Integrated Rural Development Program, that is the IRDP, the National Old Age Pension Scheme, the National Family Benefit Scheme, the National Maternity Benefit Scheme, Annapurna, Integrated Rural Development Programs, Rural Housing, the Indira Awas Yojana, Mahatma Gandhi National Rural Employment Guarantee Act. All of these were also initiated to control poverty in India and are worth mentioning schemes in this context. Poverty line determination. 1 in 3 Indians lives below the poverty line according to the Tendulkar Committee report, which used a measurement of goods and services rather than calorie intake to calculate poverty. A new method to draw the poverty line has resulted in an increase in the number of people living below the poverty line in India, from 27.5% of the population to 37.2%. The All India average rural poverty line is set at a monthly expenditure of Rs 446.68 paisa a month. The national urban poverty line is at Rs 578 and 8 paisa a month. Goa's rural poverty line is the highest, pegged at Rs 608 and 76 paisa a month, whereas Delhi is Rs 541. However, this estimate has come under severe criticism because of the purchasing power of the rupee and galloping inflation, especially the food prices.